Hello, I'm Dr. Susan Love. Welcome to our webinar on doing research in women and the Love Avon Army of Women. Today we're going to review different aspects of moving your research from animals into women, and then tell you more about how you can use the Love Avon Army of Women to accomplish these goals. Our mission at the Dr. Susan Love Research Foundation is to eradicate breast cancer and to improve the quality of women's lives through innovative research, education, and advocacy. And to do that, we try to identify the barriers to research and get rid of them, and in every way that we can. And certainly the Love Avon Army of Women is one of these efforts. So really, in the last 25 years, over $1 billion has been spent on breast cancer research by Komen for the Cure, and the NCI and the NIH have spent $705 million, and the DoD has spent another $138 million. So a lot of money has gone into breast cancer research, but we still don't know the cause. Much of the research never gets translated, and this is a problem. So a lot of this research money goes into studying rats and mice and other animal models, but it never gets to the next step into people. Partly because researchers don't know how or where to get human samples, they don't know what's involved in designing research on women, or how to get the appropriate grants, and we hope we can help with that today. If you look at the major funding organizations that fund breast cancer research, all of them are having an increasing emphasis on translational research and on focusing on the tangible impact of the research in people. So it's no longer going to be good enough to just focus on a cell line or focus on an animal model if you don't have a plan as to how you're going to translate that and make a difference in women's lives. Translational research is a way of thinking about and conducting scientific research to make the results of research applicable to the population under study. So it's come to be seen as the key missing component in the return to investment from breast cancer research money. And another definition is that it's the conversion of health research into information, resources, products, or tools that can be used by public health or medical professions and by the public to improve their health. So if it just makes rats better, it's not going to help. If you look at this continuum, which I got from Dr. Mel Cavanaugh Lynch at the California Breast Cancer Research Program, you can see the two areas of translation, and today we're really talking about T1, the translation from basic sciences into human studies. So while you do this, you can also still do animal studies in parallel, and in fact often need to do them. So you do some research in people, then you go back to the animal model, then you go back to the people, and it's an iterative process before you're really ready to be fully into the clinic. Some of the barriers to translational research are the fact that really the approach and the goals are completely different. So on the one hand, in basic science, you're trying to understand a pathway or a single problem, and it's a very reductionist approach. On the other hand, when you're doing translational research, you're working in all the complexities of people, and it's a much more comprehensive approach, but also more complicated. And it takes a lot more effort to do. So what are the barriers to doing translational research? Well, one is the lack of understanding of the disease and the differences between animals and human with a lot of researchers. Failure to include all the areas of expertise and input, taking something that is really interesting scientifically but not figuring out how it would apply in the clinic and how it could be important in the clinic. And not really asking the question first, are the results of this study likely to be applied to the clinical or community setting at a cost that's acceptable, at a risk that's acceptable, and who would benefit? If you don't answer these in advance, you end up with interesting research, but it's never going to help anybody. So the conclusion is that biomedical scientists have a duty to move their research findings towards the ultimate goal of improving health. The definition and pathways of translational research are evolving, but it requires careful consideration of the specific endpoints and goals, the steps and the barriers in order to get there, and it needs a team, and it needs close collaboration. So we're going to talk a little bit more about not just who the team is, but what their roles are in doing translational research. You need appropriate design, and for almost all of the funders, you need advocate and clinical input into the design of the study and the conduct of the study. There are regulatory issues. You need IRB approval in order to do research on people, and there are recruitment issues. How are you going to find the people or the tissues that you need? And that's where the Love Avon Army of Women comes in. So the first requirement that most funders have now is that you include advocates in the research. Why? How? What do they do? I mean, most basic scientists have no idea how to get an advocate involved in the research or what to do with them once they get them. So they tend to call them the night before the grant is due, get their name from somebody else and say, can I put you on my grant? And that really is not taking full advantage of what the advocates can bring. Qualified advocates are actually trained and experienced in the science. Many of them have taken Project LEAD, which is a program of the National Breast Cancer Coalition, and it is a 4 or 5 day intensive program which trains them not just in the science but in peer review, and they're trained by top basic researchers. So these are not just any old woman who's had breast cancer off the street. These are people who are very interested in participating in the research process. Many of them are involved in peer review, and so a lot of them will be reviewing your grant proposal, and certainly having good advocate input in developing the proposal will make it more appealing to the advocate who is reviewing it. And they can contribute really to every level of your study. So if you look at advocate collaboration, they can do the lay abstracts or help with that, the dissemination of the results. They also can help plan the clinical trials and participate in the Data Safety Monitoring Board. They can help you with the Institutional Review Board and recruitment. And then they can help you think about the side effects, the quality of life, the translation of results to the patient, and what would be acceptable and what won't, and then help with consent forms as well. So they have a role from the beginning to the end of the research project, and you really need to take full advantage of that. Many of them, if you look at the experience of advocates now over the last 20 years, when we've really been more and more involved in the science, they help develop the California Breast Cancer Research Program. They're on the council, they do peer review for them, and they participate in grants. In the Department of Defense Breast Cancer Research Program, they're on the integration panel, they're in the peer review, and they participate in grants. On advisory committees, they're in the Army of Women, among others, and they help to, on the California Teacher Study, and they help to advise researchers and research as it's ongoing. So don't underestimate the ability of the advocate to really help you in your research. The next level that you have to worry about is regulatory, and so what are the requirements for IRB approval? You have to have IRB review and approval prior to starting a study on people. There must be continuing IRB review during the course of the study, and no changes can be made to the study without IRB approval. This is really critical. Now, what triggers IRB review is any research involving human subjects. And research means any kind of investigation, including testing, evaluation, different products. All of this is considered research. In addition, a human subject means any living human being about whom an investigator is going to collect data, intervention, or interaction, or identifiable private information. So what are they looking for in the IRB? Their role is to protect the people, the patient. And they're going to be really the advocate of the patient. So they're not working against you. It's just they're the representative to make sure that you don't inadvertently harm people and that all the safeguards are in place. So they're looking for risks for human subjects in relation to the benefits, the selection of the subjects, whether it's representative, whether the consent is appropriate, whether you're monitoring for safety well enough, whether there's adequate provisions and adequate safeguards. You don't need an IRB for certain kinds of studies. If you're doing them in an educational setting, and it's part of research looking at educational testing, something that's not considered to have a lot of risk. And if you do a retrospective chart review, you don't need IRB approval. demonstration projects that are not really projects of research, and taste and food quality tests. But the majority of research needs IRB. And if there's any question in your mind, it behooves you to talk to people in the IRB and find out whether you need them, because you can't take care of it later. In terms of recruiting for research in people, there's two aspects. One is biological samples and the other are the people themselves. If all you need are samples, there are a couple of different ways you can get it. Normal breast tissue and normal biological samples, we can help you get at the Love Avon Army of Women, and we'll be talking more about that. And also the Komen Normal Breast Tissue Bank. They have almost 100,000 specimens, well annotated, of breast tissue, also blood and serum from normal women that you can apply and get the samples, and you don't have to do any recruitment. They're already available. In terms of tumor tissue, then you are best to find tumor tissue to find a local breast surgeon who will be able to take some tumor or share some tumor with you, or a local pathology department. This is not something that any of the current recruiting mechanisms are that good at. But sometimes your institutional, if you're in a big academic center, will have a tumor bank where you can get specimens as well. And so that's where you would look for them. And that's the best way to do that. In terms of recruiting people for studies where you're going to do an intervention, or whether you want to have a specific way of sampling or a specific way that the tissue is handled, then you can either do it in the traditional way, which is your local institution, put up flyers in the elevator, local advocacy groups, medical practices, or you can use the Love Avon Army of Women, which is a national resource of both healthy women and women with breast cancer. The goals of the Army of Women really are to facilitate and accelerate research. Those traditional standard ways of approaching recruitment take a long time and a lot of money, and are often not very successful. So we want to encourage all women to take the next step in breast cancer advocacy and participate in research studies. We want to get women interested in the concept of research so that they're more understanding in terms of funding of research and supportive of research results. We want to forge a partnership between women and researchers. You don't always have to go through medical doctors. In fact, they're busy taking care of patients, and sometimes if you go directly to the public, you can actually do things a lot faster. Increase the amount of research focused on the cause and prevention, accelerate it, and encourage researchers to study clinically relevant questions. So how does it work? Well, women who want to participate or are interested in considering participating in research sign up online at armyofwomen.org, and they get email announcements of available studies. Basic contact and demographic information is collected, but not much, just date of birth and ethnicity and zip code. So we don't collect a lot of information because we'd have to keep it up to date, and we don't match anyway. It's really an email list of people who are interested in research opportunities. We then send call to action emails out to the entire database. We don't match. And the reason is that sometimes even if the woman, say we're recruiting for a study that needs breast milk, she may not be breastfeeding, but her granddaughter could be breastfeeding, or her neighbor, or somebody at church. So every time we send out these e-blasts, they get sent out further. The foundation manages the subject list, and the information is then passed on to the researchers. So they RSVP, they go through another secondary screen, and then we pass them on to you. And this has been quite successful. Now, in terms of researchers, you register at armyofwomen.org, and that gives you access to the current membership base, which is at the moment 352,000 women, and it keeps going up all the time. If you have no funding, you just have a concept and you want to do research with the Army of Women, then what you do is you apply, we review by the Army staff the study, and then we'll give you a letter of support to be included in your grant and support it. If you've got now already funded and your study's not been peer reviewed, then we review it for scientific merit and appropriateness. So we have 2 scientists from our scientific advisory board and an advocate review it. If your research has already been peer-reviewed and it's funded, then we're not going to re-peer review it. It's a waste of time. Then we just review it by one advocate and one researcher to make sure it's appropriate for this mechanism. Our scientific advisory board consists of 35 members. 50% are advocates and the rest are researchers and clinicians. All studies that we recruit for have to have IRB approval, and they also have to get a secondary approval for online recruiting, and we help you do that. Over 90% of the studies are peer-reviewed, funded studies, and it costs $1,500. And we will continue to recruit until you close the study. So it costs us the same whether it's a big study or a small study, whether it's local or national, and therefore we have one flat fee. The Army of Women requires a partnership between the women and the researchers, so you're responsible for explaining the research to the participants and then communicating the aggregate results back to the public. Whether the person, if you're conducting the research yourself, or through a Dr. Susan Love Research Foundation hosted webinar, so that allows the women to hear it from you. Through this process, we close the loop. The women are not just guinea pigs, but they are partners in getting the research accomplished, and that's how we think it should be. Right now, we have over 352,000 women who are recruited and a few good men. 86% have never had breast cancer, while 14% are survivors and are going through active treatment. 74% have no family history, 23% have one first-degree relative, and 3% have more than one first-degree relative. 27% are young, under 39, 50% between 40 and 59, and 23% over 60. In fact, we have women up to age 100. Although the majority are Caucasian, we do have diversity, and we have been able to recruit for African American studies, Latina studies, and other minority groups. 44 studies have been launched, and 21 studies have been closed in the 2 years since we started. 6 studies we got them everybody they needed, but they decided to increase their enrollment because it was so successful. We've had 2 international studies, 18 national studies, and 24 regional studies. And on an average of 1,500 new recruits every month to the Army, and an average of 2 studies are launched every month. And over 50,000 women have participated in studies. 2 examples of studies that have used the Army show you how it's not just you can do online questionnaires, but you can also collect samples, and they can be local or national. The BEAM study was 300 healthy women needed to collect nipple aspirate fluid, core biopsies, and blood. It was in 2 sites, one in Chicago and one in Washington, D.C., and we put the study out, and we got 739 RSVPs. Now, not all of those then enrolled in the study because some were not eligible or couldn't participate for other reasons, but we've rapidly moved this study along. The MELCs, they had been recruiting for several years prior without success. The MELC study is a national study. They wanted milk samples from 250 lactating women, and in 24 hours we had recruited 31 women, which represented a 6-month acceleration of recruitment. They decided to increase their enrollment from 250 to 2,000, and to date we've recruited 334 women for them, and we are their sole source of recruitment. We've also had studies that were focused on the minority population that we've recruited for. One is called the GAP study, where they're looking at differences in experiences of black or white women. They needed 400 women, 200 black, 200 white that were newly diagnosed. We've recruited 232, 25% black, and within 2 weeks of the blast, we had 116 volunteers. It's also interesting in this study that they required the women to go get their medical records as part of the study, and 90% were able to get and return the medical records. So what we do best, the kinds of studies we're best at, are healthy women who don't have a history of breast cancer, or survivors who have completed treatment. We're not so good at that window between being diagnosed and starting treatment, because the women are usually quite involved in figuring things out and not as available for research. Breast cancer survivors who have completed treatment are good. Online studies are very good. Samples we're able to collect where you can have a kit and send it to the patient. That milk study, they sent them a kit, they put some milk in, they shipped it back. National studies we're better at, and regional studies in major metropolitan areas, as well as studies that need specific minority groups or groups of small populations, because we have the whole country to choose from. We're capable of getting patient-reported health and clinical data, blood, either at your own institution or via a kit, and we can sometimes facilitate collection through one of our partners. Urine collected at your institution or via a kit, saliva collected at your institution or a kit, ductal fluid, and tissue. We can facilitate the collection of normal tissue. We're not good at collecting tumor tissue because we really don't have an access to fresh tumor tissue. Where we struggle are women who are recently diagnosed, fresh frozen tumor samples, regional studies conducted in less metropolitan areas, or randomized clinical drug studies where our women really are not so interested in participating. The feedback we did in our recent survey of the researchers showed 100% would recommend the Army as a recruitment source and would use it again. 86% said it was significantly more effective recruitment method than anything they had previously used. One researcher said that it was low cost, high yield, efficient recruitment. They got 52 volunteers and 22 took part in the study, and this was done in weeks. We had spent a year in clinics and obtained about the same number of women, but at significantly greater cost in terms of dollar and staff time. Another researcher said online recruitment reaches a large amount of people in a very short amount of time, and the volunteers clearly trust the Army of Women and are eager to participate in research. So the process is simple, it's a very successful tool, and we encourage you to use it. And we're going to take you now through the steps that are involved in actually using the Army of Women as a researcher. And I'm going to have my colleague, Leah Wilcox, who is the project manager for research for the Army of Women, go through this with you.
Hi everyone, I'm Leah Wilcox, the Army of Women Research Project Manager at the Dr. Susan Love Research Foundation, and I'm going to go through the steps of registering as an Army of Women researcher and then submitting your application. So the first step in the process is to register as a researcher on the Army of Women website. We're going to go to the researchers.armyofwomen.org/for-researchers, and that's on the slide. And you're going to create your account, which is where you will go in to submit your application. So this is what the page is going to look like. You're going to click on the For Researchers tab originally, and then it's going to take you down to the Register Now tab. And from there, you're going to see the researcher registration form. Here you're going to enter in some limited information, your name, degree, research institution, your zip code, and email address, and then you're going to create a username and a password. And this is something you're going to want to write down because this is how you access your account at a later time. So once you register, you'll get an email welcoming you to the Army of Women, and then from there you'll be able to go in and submit your application. So if you are looking to submit an application for funding and you're interested in receiving a letter of support from the Army of Women, we're happy to review your application. You'll go into the web page and enter the requested information, contact information, institution information, pending funding source, and the expected funding date, the number of women needed, the inclusion-exclusion criteria, and then what are your project needs from the Army of Women. So you have to let us know, are you looking for data only, or are you looking to collect specimens from the women as well? Then you'll upload the requested documents, and these are going to be the NIH BioSketch or your CV and the scientific abstract. So this is what the web page is going to look like. You're going to submit your research proposal up in the left-hand side. Submit your research proposal. It will take you to this first page, and you're going to enter in your project title and then check off whether or not you have funding. So if you're looking for a letter of support, you'll check off, no, I don't currently have funding, and then you'll continue to the next step. And here's where you'll enter in your personal information and your institution information, and then you're going to enter in your pending funding source and the expected funding date, any list of collaborators, the number of women needed, the inclusion-exclusion criteria, and then here's where you'll enter in the types of specimens or just data that you need from the Army of Women for your study. The next page, you're going to upload your NIH BioSketcher CV, the scientific abstract, and from there you can click on Request Letter of Support from the Army of Women and your application will be submitted. If you've forgotten something, you can go back a step, or if you need to get a hold of some of the documentation, you can exit and save the application for later. Go back in, log on, and finish the application when you're ready. So what's the review process? When you submit an application for a letter of support from the Army of Women, it's reviewed internally by the Army of Women team at the Dr. Susan Love Research Foundation. We look at it to determine if the study is a good fit for the Army of Women and if the Army of Women is a good fit for the study. If approved, you will receive a letter of support for your grant application and a cost sheet for budgeting purposes to also include. Now on the other side, if you already have funding for your study, you're IRB approved, and you are interested in recruiting through the Army of Women, we have a separate application process for that. Again, you're entering in the requested information, very similar to the letter of support. The only additions, you're going to need to check off a primary area of study, and then the IRB approval status of your study, and then provide the contact information for your institutional contracts and grants officer. The next step is to upload the requested documents. Again, you're uploading an NIH BioSketch or a CV. We would like a scientific abstract and also a lay abstract if you have one. The budget award letter, the complete grant application, and your IRB approval documentation. If you do have any sort of flyers or brochures, you can upload them as well. So this is what the research page is going to look like. You're going to the same submit your research proposal. Here you'll click yes, you currently have funding. Takes you to the next page where you're entering your institution name, your personal information. Again, you're going to list any sort of information on the number of women needed, the inclusion-exclusion criteria, and the project needs from the Army of Women. And then you'll upload your NIH BioSketch and the scientific abstract and continue on to the next step. And here you're going to enter in the primary area of study and secondary area if applicable. Upload your budget award letter, your complete grant application. You can enter in some information about the study protocol. You're going to check off whether or not it's IRB approved, and if it is, upload your IRB approval document and any recruitment flyers. Finally, you're going to check off the box on whether or not you need help from the Army of Women to collect biological samples. So if you're collecting tissue and you need some help, you can check off yes there. And then information for your contracts and grants officer. The next step is to review and submit the application. If you click on that, you'll review everything and submit it if ready. And again, you can go back or you can exit and save the application for a later time. Once we receive an application for Army of Women recruitment, we again review it internally by the Army of Women team at the Dr. Susan Love Research Foundation. If we determine that the study is a good fit for the Army of Women, then we submit it to the Army of Women Scientific Advisory Committee for review. And as previously discussed, if you have peer-reviewed funding, it's going to be reviewed by one scientist and one advocate. If it's non-peer-reviewed funding, it's going to be two scientists and one advocate. If a study is approved by both all reviewers, then the email that will be sent to the Army of Women database is drafted and sent to your IRB for approval if necessary. We execute a memorandum of understanding between the foundation and your institution, and we issue a fee, an invoice for the $1,500 flat fee. Once the email is sent to the Army of Women database, women are able to self-select if they're interested in participating in a study. These interested women undergo a secondary online screening, and then the approved names and contact information is sent to the PI. From there, the PI proceeds with the consent and the enrollment process. If you have any questions regarding the Army of Women or the application process or any information, you can contact me directly at leah.wilcox@dslrf.org. My phone number is on here as well, and you can always go to our website for additional information. We do have a frequently asked question page for any additional questions, and there's a lot of information on there.
Thank you very much for joining us today at this webinar. We hope you've learned something that will help you move your research forward so that we can all work together and eradicate breast cancer.